Remember those odd leg aches as a kid? Like,
Yeah.
they just seem to pop up out of nowhere, usually at night.
Oh, yeah, definitely.
Well, tonight we're doing a deep dive into exactly that.
Yeah.
Growing pains. Or the more technical term is benign limb pains of childhood.
That's right.
We've got some pretty detailed revision notes here, and our mission really is to help you get to grips with this super common condition.
Exactly. So you know what's typical, what's probably okay, and maybe when you need to think a bit further.
Right. So let's start right there. What are we actually talking about when we say growing pains?
Okay, so growing pains are these recurring episodes of leg pain, usually aches, that children get.
And they tend to happen when?
Typically, it's the late afternoon or evening, often, after a day where they've been running around a lot. And importantly, there isn't an obvious injury.
Right. No fall or knock.
Yeah.
And what's causing it? I mean, it feels like we should know by now.
You'd think, wouldn't you? But the the exact cause, still actually unknown. Yeah. The thinking now is that it's probably multifactorial. So, a mix of things.
Like what?
Well, kids are so active, right? So, muscle fatigue, just general overuse from all that playing and jumping, that seems to be a big part of it.
Okay.
And of course, they are growing. Bones, muscles, everything's developing rapidly. That whole process, that adaptation, likely contributes too.
So it's not literally the bones painfully stretching like the name suggests.
No, that's sort of an older idea. It's understood more now as the muscles kind of working hard to keep up with growth and activity.
Interesting. Okay. Were some kids more likely to get them? Any clear risk factors?
Honestly, well-defined risk factors are kind of lacking. We haven't really nailed those down. You do sometimes see it run in families, so maybe a genetic link. And sometimes kids who've had other sort of minor muscle or bone issues might get them, but it's not a strong predictor.
Gotcha. Not much solid there then. So pathologically speaking, what's the current thinking on what's happening inside the leg?
The main idea revolves around temporary muscle fatigue and sort of tension.
Okay.
Think about it. You've got rapid growth spurts happening at the same time as lots of physical activity. It puts quite a demand on those developing muscles.
Like they just get a bit overworked.
Exactly, leading to these intermittent aches.
Right. Now, I imagine for parents, any leg pain is worrying. How do you know it's just growing pains and not,
Yeah.
well, something else?
Absolutely crucial point. This is a differential diagnosis, making sure we're not missing something else.
Because there are other possibilities.
Oh, yes. Things like actual injuries, maybe inflammatory conditions like juvenile arthritis, infections in the bone or joint, or much more rarely, even malignancies, other systemic things too.
Okay, that sounds scary. So how do we tell the difference? Are there clues, sort of red flags for things that aren't growing pains?
Yes, and this is key for reassurance. With typical growing pains, remember these points. The pain is never there first thing in the morning when they wake up.
Okay, morning pain is a warning sign.
Correct. Also, the child won't have a limp. They'll be running around normally during the day. Their activity isn't limited.
Right.
They should seem perfectly well in themselves, no fever, no weight loss. The physical examination by a doctor will be completely normal.
Normal exam, okay.
Their motor milestones, walking, running, should be normal for their age. And the symptoms are intermittent, they come and go, often worse after a busy day.
That's a really helpful checklist. No morning pain, no limp, no activity limits child as well. Normal exam, normal development, comes and goes after activity.
Exactly. Nail those. And you're likely looking at growing pains.
And how common are we talking, epidemiology-wise?
It's quite common. Specific UK data is a bit limited, but generally we see it most often in kids aged about 3 to 12 years old.
Okay, primary school age mostly.
Mm-hmm.
So if a child fits that classic picture, do they need x-rays or blood tests?
Usually no. For typical growing pains, investigations aren't needed. The diagnosis is clinical based on the story, the history, and that normal exam.
But if there are those red flags?
Ah, yes. If there are atypical features or anything concerning like that morning pain, limping, swelling, fever, then yes, definitely further evaluation and investigations are needed to rule out those other conditions we mentioned.
Makes sense. So assuming it is growing pains, what can be done to help the child when they're uncomfortable? What's the management?
It's really about symptom relief and reassurance. Simple measures often work wonders.
Like?
Things like warm compresses or a warm bath. Gentle massage of the legs can feel good. Sometimes simple stretching exercises help.
What about painkillers?
Yeah, over-the-counter options like paracetamol or ibuprofen can definitely be used if the pain is bothering them, especially at night. And importantly, reassure the child and the parents that it's not harmful and it will pass.
That reassurance must be huge. And the long-term outlook, the prognosis.
It's excellent. Growing pains are completely benign. They don't cause any lasting damage. They're self-limiting.
Meaning they just go away on their own.
Exactly. Symptoms tend to lessen over time and usually resolve completely by the time they hit adolescence.
That is definitely good news. So no long-term complications or permanent issues.
None at all. I mean, yes, the pain can be upsetting. It can disrupt sleep sometimes, cause temporary discomfort. But there are no significant medical problems associated with growing pains down the line.
Okay, let's quickly recap. Growing pains. Very common leg aches in kids. 3 to 12-ish, usually evenings or nights, often after activity. Seems linked to muscle fatigue and growth. Diagnosed mostly by the story and a normal exam. Key is distinguishing it from other things by looking for those specific features. No morning pain, no limp, etc.
You've got it. And I think the big takeaway for anyone listening, especially parents or those working with kids, is that while leg pain can be worrying, understanding these typical features of growing pains can save a lot of unnecessary anxiety.
Absolutely. It empowers you to know what's likely normal development. A final thought maybe, just considering how understanding these common benign childhood discomforts really changes how we approach them, moving from worry to reassurance.
Well said.
And if you do want to solidify your knowledge on pediatrics or other topics for exams like the MSRA, definitely check out PathMSRA.com.
And there are great free resources too at freemsra.com. Worth a look.
Brilliant. Thanks so much for walking us through that. And thank you for joining us for this deep dive. We'll catch you next time.